shame can be really paralyzing, and shame is this emotionally painful experience that stems from a belief that I'm flawed, or I'm inadequate, or I'm bad. It's different from guilt. Guilt says my behavior's bad. Shame says I am bad. There's something inherently deficient about myself. And it's from this belief that people experience these incredibly painful, self-critical, shaming emotions that are very unpleasant and uncomfortable. And for some people, it creates this vulnerability to turn to something that will give them a mood-altering experience. And certainly a lot of the behaviors that activate pleasure-reward circuitry in the brain, such as drugs or alcohol or food or sex, and in the case of this discussion, gambling, can create that mood-altering experience, the ability to escape or disconnect from what otherwise is kind of a painful reality when people experience shame. A lot of different things can trigger shame. Sometimes it's a conflict with a loved one or a family member. Sometimes it's an experience at work where maybe you don't do something the way your boss had hoped, and then you feel a lot of shame or inadequacy about that. Sometimes it's just this inability to achieve personal goals. But for whatever reason, a whole constellation of things can actually trigger shame for people. That shame in turn then becomes a vulnerability to seeking out ways to kind of escape or disconnect from that painful emotion of shame. We've done research on shame, as have many others, and we found that shame does positively correlate with problem gambling. And in fact, researchers in Canada have gone beyond that just initial association between shame and problem gambling. They've actually tried to understand a little more specificity around that relationship. And what they found was that people who are motivated to gamble because of this desire to escape or disconnect from painful emotions are vulnerable to turning to gambling in problematic ways. And in fact, people that then experience shame and who are vulnerable to turning to gambling as a way of coping are particularly at risk of developing a gambling problem. So in other words, what the researchers are saying is that this desire to escape or disconnect from this painful emotion of shame then becomes a catalyst to escaping or turning to gambling as a form of escape. And it's that dysfunctional or maladaptive coping strategy, right? The idea that that way of coping with shame doesn't work, but that's the mechanism, if you will, by which shame is correlated with or related to problem gambling. So what are we saying? I mean, what we're saying here is that it's these underlying beliefs that people have about themselves that make them vulnerable to shame, and then not having any way to cope with shame or just difficult emotions in general, then in turn makes them vulnerable to turning to any kind of behavior, or in some cases substance abuse like alcohol or drugs, in order to escape or deal with that uncomfortable and painful emotion. In the case of shame, there are a number of different things that we try to do in therapy with patients who may be turning to gambling as a way of coping with shame. One of those things is trying to get people to reorganize the way they think about themselves, their beliefs, their values. And in doing so, we kind of reorganize that so that those beliefs about the self are more healthy. We call this cognitive behavioral therapy, and therapists, any licensed therapist is aware of cognitive behavioral therapy approaches, where really we're trying to reorganize the way people think about their thinking. And in doing that, they think in more healthy ways so that they are not plagued by these just really irrational beliefs and thoughts that trigger shame. We also try to give people just coping strategies in general, coping strategies that allow them to respond to negative emotions such as shame in ways that don't get them in problems with their behavior, such as gambling or drugs or alcohol. One of the things that we do is we help them, for example, cultivate self-compassion. Dr. Kristen Neff out of Texas has done a lot of research on self-compassion and in fact finds, as we have found in our own research, that helping someone cultivate self-compassion can actually really reduce the extent to which they experience shame, but not only that, to the degree to which the shame then triggers them to turn to their coping behaviors, if you will. There's also been some research on mindfulness meditation. Mindfulness meditation is cultivated through people learning how to just be present in the moment and not judge whatever experience that they're having, but just pay attention to what they experience and feel in their body in that moment and not make up a story about that. So for example, if someone were experiencing shame, shame often comes with a story, and that story is I'm bad, I'm broken, I'm flawed. In mindfulness meditation or mindfulness approaches to these kinds of uncomfortable experiences, a person would just sit with that experience and notice what they feel in their body without making up a story about what that feeling means, but just notice what that actually it feels like and not passing a judgment on it. This is neither good nor bad, it's just an experience I'm having. And like every experience, there's an ebb and a flow. It comes, it goes. And by learning how to be just present with our experiences through mindfulness meditation exercises, people learn that they can survive some of these uncomfortable emotions without having to react to them in ways that historically have got them into trouble, i.e. turning to gambling or drugs or alcohol in problematic ways. So I think the news of hope for anybody who's struggling with a gambling problem and that is doing that as a way of escaping or disconnecting from painful emotions such as shame can take hope that there is help and that help has been shown in research to be effective in helping people reorganize that relationship with shame, reorganize that relationship with some of the irrational beliefs that they have that give rise to shame, and also empower them with a lot more effective coping strategies that reduce or eliminate any need to turn to a behavior such as gambling or drugs or alcohol or anything else that they have used in kind of an addictive way to deal with those problems. And people that kind of go through that journey and that process at the end find that they're able to look at themselves and others in a lot healthier way, that they're able to approach life in a way where they have more confidence, they have a better sense of self-worth and self-esteem, and they're not plagued by these distorted beliefs about themselves and who they are that then make them vulnerable to turning to these various addictive behaviors.